Click.
Okay. PPE is on. Is my scene safe?
Scene is safe.
How many patients do I have?
1 patient.
Alright, so I'm being dispatched to a 20-year-old male who is complaining about chest pains and difficulty breathing. At this time, ALS support is not needed and C-spine is unnecessary with the current given information. Next, I'm going to go ahead and introduce myself to the patient. Hello, my name is Edwin Cruz. I'm the EMT. How are you today, sir?
Good. My name is Wilfredo. My chest hurts from breathing in.
Breathing in. Okay. So at this time, we can assess that the patient is he is alert and his airways are clear as he's speaking to me clearly. So as his breathing is he has difficulty breathing, we're gonna go put him on 15 liters of oxygen a minute with a non-rebreather mask. Put a mask on you, sir. So what we're gonna do next is we're gonna go and take a look at his pulse for his circulation. So his pulses are strong and they're even on both sides. So next we're going to take a look at his skin. His skin is nice and dry, it's warm, and it's not pink. So next we're going to go ahead and go on to the history portion of this. So sir, when did this all happen?
It happened like 2 weeks ago.
2 weeks ago? So what causes your the pain to hurt?
When I breathe in.
When you breathe in? Okay. So in this case, what hurts? How does it feel when it hurts? Is it a sharp pain? Is it like stabbing? Is it like rolling on it instead?
It's like a sharp pain whenever I inhale.
Okay, sharp pain whenever you inhale. So in this case, does it go anywhere else?
No, it's just only my chest.
Okay. On a scale of 0 to 10, 10 being the worst pain you've ever felt in your life, what would you rate this at?
I rate it as a 6 out of 10.
Is it 6 out of 10? How long ago does it start?
2 weeks ago.
Okay, so now we're going to go ahead and conduct a secondary assessment on the cardiovascular side. So in this case, we'll be taking his vitals of his blood pressure, his pulse, and his respiratory rate. So we're going to go ahead and start off with his blood pressure. Okay, so his blood pressure is going to be at 120 over 80. Next we're going to go ahead and take his pulse. So his pulse is at 60 beats per minute. Next, we're going to go ahead and take his respiratory rate. So, sir, I'm going to go ahead and take a look at your chest while you're breathing. Okay, so we're going to go ahead and put down that the respiratory rate is 18 breaths per minute that are short and labored at the same time. So what we're going to go do for the time being is we're going to leave him on the O2 tank for about 20 minutes, and we'll go ahead and take another look as to what's going on with him, see if he's improved or if he's gotten any worse. In that case, we will go ahead and see if whether or not we need to go code 3 or code 2 over to the hospital. So just to reassess, we have a 20-year-old male who is complaining about chest pain and difficulty breathing. His airways are clear. His breathing, he's on a non-rebreather mask at 15 liters of O2 per minute. His circulation is strong with his skin being warm, dry, and not pale. His blood pressure is at 120 over 80. His pulse is at 60 beats per minute, and his respiratory rate is at 18 breaths per minute with labored and short breaths. And that is it.